Welcome back to the Holistically Well podcast. I'm Dr. Kayla Borchers, and this episode is all about helping you understand common but not normal cycle irregularities, or honestly, painful periods, or really heavy menstruation and PMS symptoms that quite honestly are common amongst our friends and amongst our family members, but not normal. So to really help you understand what is a normal cycle, what should our monthly menstrual cycles look like, which is truly a marker of optimal health. So you do not need to be trying to conceive, to get pregnant by listening to this episode. These are takeaways for every single female who is of menstruating age. So really, that teenager and beyond, because understanding our menstrual cycle gives us so much insight into your overall health and is foundational for fertility, whether you are trying to conceive now, within the next year, or potentially 5-10 years down the road, right? What we do now can help that fertility for when we are finally ready to conceive, and will help you optimize it now if this is you currently. So many women don't understand that cycle irregularities are really early warning signs that something is off. There is a hormonal imbalance, there is a metabolic issue, and this needs to be addressed not only for fertility, but for your overall well-being, to help avoid chronic health issues like autoimmune conditions, diabetes, heart disease, bone health issues, osteoporosis, stress fractures, regular fractures. Those all have an early warning sign with a cycle irregularity. So stay tuned. We're going to dive into all of this. Now, just because an issue is common, such as PMS symptoms or irregular periods, does not mean that it's normal or optimal. So this podcast, we really dive deeper. We look at the root cause, and this is going to be true across the variety of women's health issues that our society is facing today. And so too often, issues are brushed off as just part of being a woman or just the way it is, when you need to know that it's not normal. And too many women in our life are experiencing cycle irregularities today, and we are in a fertility epidemic. And it's because we are not addressing these issues head on earlier in a young woman's life. And so the earlier we can address this, the easier it is to help regulate those cycles from a root cause approach. And then we can see fertility, bone health, gut health, everything else falls into place as we figure that out. So the menstrual cycle truly is a vital sign, just like blood pressure or heart rate. It provides real-time insights into your overall health. And I'll argue that it provides even more than real-time insights. So if we look at blood work, if we look at blood pressure or heart rate, it's a peak in time. It's looking at what those values are right in that moment. So if you walk into your doctor's office and you're stressed out, you have what's called that white coat syndrome, and your heart rate shoots up, your blood pressure rises, and they're like, whoa, are you a little nervous? Or is this just typical? It can be hard for them to decipher that because it is a peak in time. Your menstrual cycle is looking at your health from really the 3 months prior to that cycle, because our hormones work in 3-month chunks. So decisions you make now can impact whether you're going to have a regular cycle or not 3 months from now. And so it's more than just a peak in that specific time point. It's looking at several months to even more than that of a timestamp in your health. And so that's where I argue that it's even more beneficial than some of these other vital signs that we have. So from today's episode, you're going to take away the key signs that your cycle may be helping your fertility or negatively impacting. You'll better understand the root causes behind cycle dysfunction and holistic strategies that you can start implementing right away to optimize a healthier, more fertile cycle for you. So what does a normal healthy cycle look like anyways? So the typical length is 26 to 35 days. And we have this range because, a lot of women will say, you might hear also like 28 to 32. So it's kind of that mid-average, but we can have women who are consistently getting their cycle every 35 days, and that's fine. So we really want to look at what is consistent for you. And if it falls outside of that, to dig deeper. The phases of our cycle, so about every month on average, right, we should have menstruation, which typically will last from 5 to 7 days of that active bleeding, which trails off those latter 2 days of your cycle to more so spotting perhaps. Then we move into your follicular phase, and then ovulation, which ovulation in and of itself, while it's the main event, it's literally 1 day. It's 1 day of that cycle. That egg lives for 1 day, and if sperm is present, which sperm can live for about 5 days typically. So if sperm is present prior to ovulation and still hanging around, or if sperm comes into play within those 24 hours of that egg's release on that ovulation day, then we may become pregnant. If sperm is not present, if sperm does not join that egg after it releases within 24 hours, then that egg simply moves through. It is not inseminated, right? And we move on to that luteal phase of our cycle. And then we repeat that every month. So signs of optimal fertility would be regular ovulation. So we see a temperature spike, which is called your basal body temperature. It shifts whenever we have that ovulation, and we get a presence of healthy cervical mucus, which really is the pathway for that sperm to get to where we want it to go. So if you're staying really dry throughout your entire cycle and you don't see some healthy cervical mucus, which kind of looks like egg whites whenever it is that true fertile mucus, then we would also have some concerns, okay? So it's not only looking at the bleeding, but it's looking at the length, and it's looking at that regular spike in your basal body temperature, and then the presence of healthy cervical mucus for that full picture of your menstrual health. So a cycle report card for optimal health really affects, like I said, not just your fertility, but irregularities can also indicate underlying issues such as gut dysfunction. So maybe a leaky gut, or we have higher inflammation with eating certain foods, and that might affect our cycle. We could have thyroid imbalances. So are we having a hyperactive or a hypoactive, an underactive thyroid? Are we experiencing chronic stress? So chronic stress is something I see in so many of my patients as a physical therapist, and something that we work on a lot within my clinic to help regulate our stress response. We can do that with deep breathing. We can do that with the right amount of exercising. I'll find a lot of clients are either over exercising or under exercising. In fact, I have a great blog post on this that I will link in the show notes for you, so be sure to check that out. It's all about exercising with your cycle and how to really listen to your body through exercise. So chronic stress can be physical stressors on the body, such as exercising, and this was part of my own story. If you listened to the first episode of Holistically Well podcast, where I talk about over exercising and that form of stress on the body. But chronic stress could also be that you are stressed out at work. It could be financial stress. It could be family stress, or it could even be infertility stressors, right? Stress is an underlying issue of that cycle regulation for a lot of women in today's society. So that is something that we dive very deep into if you are a client of mine. And then nutrient deficiencies. So we want to make sure that your body is not only getting the macronutrients it needs, so that's your big picture, proteins, carbohydrates, and fats for optimal health, but that's also looking at your micronutrients. And so if the body's not getting all of the building blocks that it needs, it may not release that egg every month, or it may not shed that lining how we want it to. So we really want to look at that we're giving the body its appropriate building blocks across the lifespan. And then environmental toxin load. So this is a new one that's getting a lot of attention recently. And I want you to understand why it can impact your hormones and thus impact your fertility or your cycle. Environmental toxins can mimic endocrine hormones in the body. So for instance, microplastics can mimic estrogen in the body. And so if we're having a high consumption of takeout coffee in our hot plastic lined cup, and then we're getting takeout food every single lunch, which is hot and comes in a plastic to-go container, that over time builds up in our body as extra estrogen and can throw off our menstrual cycle regulation. Okay, so we just want to think of that from a big picture perspective, that this toxin load talk can feel so overwhelming. We feel like toxins are everywhere. Yes, we live in an advanced society and we are going to be exposed to environmental toxins. What we want to be aware of is specifically how they're impacting our own health concerns and where we need to be really proactive about avoiding things such as endocrine disruptors that are going to mimic our reproductive hormones and throw off that really important hormonal balance in our body. So irregularities could be due to environmental toxin overload. Now, ovulation is not just for conception. It's not just to get pregnant. I mean, goodness, most cycles, the large majority of cycles throughout our lifespan will not lead to pregnancy. So ovulation is not just for conception. It's a key marker for your overall well-being, that fifth vital sign, if you will. Even if you're not trying to conceive, ovulation is essential for bone health, metabolism, and long-term hormonal balance. So signs that your cycle may be impacting your fertility. I want to break down the key red flags and why they matter. Irregular cycles would mean that that cycle is too short. So every 20 days you're getting a cycle. It could be too long, right? So every 60 days you're getting a cycle. Or it may be that eumenorrhea, which means we're just not getting our period. You might go 3 months without getting a period before getting another. So typically that's where we're like, okay, we probably missed a period here versus just having too long of a cycle consistently. So a cycle shorter than 21 days or longer than 35 days could signal a problem. And again, we want to individualize this for you. So if you go to your provider and you really dive into things and we find that a 36-day cycle is just really consistent and normal for you, that's okay. But this is looking at the big picture here, right? Now, potential root causes could be anovulation. So your body is simply not releasing an egg. Now, this may result from an underlying condition such as PCOS, which is polycystic ovarian syndrome. Or it could be to low body fat percentage. So your body just quite simply doesn't have the support that it needs to release that egg each month. Anovulation can also result from HPA axis dysfunction. HPA stands for hypothalamic pituitary adrenal axis, and this is a complex endocrine system that plays a crucial role in regulating the body's response to stress. Now, that stress may be environmental, such as those environmental toxins that we discussed that can mimic endocrine hormones within the body and throw off that endocrine system balance. Or it could be due to, again, just chronic stressors, right? So the HPA axis is this neuroendocrine system that regulates the body's stress response. Now, this all happens in the background, right? But it is something to be aware of. And this consists of the hypothalamus, the pituitary gland, and adrenal glands, which all work together to produce cortisol in response to stressors. So the HPA axis is crucial for maintaining homeostasis, which is a sense of regulation and calm. It's kind of that home base for your body and helps your body cope with stress. So if it is experiencing dysfunction and we're getting way too high of a stress response, way too high levels of cortisol, this can lead to dysregulation and a host of health issues, anovulation being one of them. Now, another root cause may be just stress-induced cycle suppression. So again, that high cortisol response can disrupt our ovulation and our progesterone levels. So progesterone is progestation. It's a very important female reproductive hormone to lead to more regular cycles. And then thyroid dysfunction. So this also ties back into that HPA axis, but hypothyroidism or Hashimoto's can delay ovulation. And so that's something else we may see as a root cause. Now, other symptoms that definitely are worth looking at would be high PMS or painful periods. So what's normal? Mild cramping is common, but severe pain, mood swings, and debilitating fatigue are not. So if you're that person who had to miss school because of PMS or painful periods, like that is not normal, right? It may be common amongst your peers or amongst family members, but it's not normal when we're looking at how the reproductive system should function. So a functional medicine perspective on why you may be getting severe PMS or painful periods would be estrogen dominance. So too much estrogen relative to progesterone. Those are like your two main female reproductive hormones. Too much estrogen relative to progesterone can drive heavy painful periods. Inflammation and prostaglandins could be another reason for the severe PMS or painful periods. So diets high in sugar and processed foods can increase inflammatory pain signals in the body. And then third would be endometriosis or fibroids. So underlying conditions that can impact fertility and this experience of symptoms such as PMS or painful periods. So estrogen dominance, inflammation and prostaglandins, and then endometriosis and fibroids would be considerations if you feel like you fall into this severe PMS or painful periods bucket. If you are experiencing spotting before your period, this may be a sign of low progesterone or luteal phase deficits, which makes it harder for implantation to occur. So if we think back to those 4 phases that we experience roughly every month, that luteal phase is when your egg may have just been fertilized and may implant into that uterine lining. If it doesn't have a healthy environment to implant and thus grow new life, then we'll see the shedding of that lining, and thus we experience our menstruation in the days to come. And so that would be something worth looking into. If you're spotting before your period, you may have low progesterone hormone or defects within that luteal phase, which makes it harder for that implantation to occur. So again, whether or not you're trying to conceive now or want to at some point in the future, you want to get to that root cause ahead of being ready for conception. Now, this could indicate chronic stress, under eating, so undernourishment, or micronutrient deficiencies. So again, more so related to that diet intake. Now, if you're experiencing very light or very heavy periods, we're going to dive into that. So too light, this could be due to low estrogen from undereating, over-exercising, or chronic stress on the body. Post-birth control syndrome can also affect our body's ability to naturally produce the right level of hormones necessary and could lead to these very light periods. Too heavy. This may indicate that we have estrogen dominance, which we are seeing a lot more of in today's society with the high level of plastic usage, because again, those microplastics can mimic estrogen in the body. We're also seeing this in fragrance and a variety of chemicals that are used in our personal care products or cleaning products. And so thus the movement for more clean, holistic household care items has been born, right? We want to make sure that we're not getting environmental factors that are leading to a higher level of estrogen in our body that can lead to those heavier periods. Inflammation can also be a reason for heavier periods from gut dysfunction or, again, those environmental toxins. And then uterine fibroids or polyps may affect the body's ability to have normal shedding. Now, if you're not experiencing clear signs of ovulation, that is another area we want to dive into. So if you're not seeing mid-cycle cervical mucus, which would be that egg white cervical mucus, or sometimes it can almost be like a glue-like or gummy discharge that you might find in your underwear or whatever you wipe when you're using the restroom. Those cervical mucus types are really imperative for signs of ovulation. as is a basal body temperature shift. So we want to see a shift in that basal body temperature. This is something that you want to take at the same time every day before you even rise or get out of bed. So for instance, you might take it at 6 a.m. every morning, and you want to see a slight shift, and that is a good indicator that you have ovulated. And then there's also ovulation test kits that you can get to help understand whether or not you did in fact ovulate in that cycle. Now, if you're not seeing these clear signs of ovulation, this could indicate chronic stress suppressing ovulation, thyroid or adrenal dysfunction, and then insufficient progesterone production, which leads to that shorter luteal phase, which is that fourth and final phase of your menstrual cycle. Finally, extreme fatigue, hair loss, or skin issues around your cycle could mean that your cycle is reflecting thyroid health, adrenal dysfunction, or lack of nutrients. Functional medicine red flags that we look at would be fatigue. We're going to dive deeper into your iron levels. You want to look at B12 or any thyroid imbalances, and those levels can all be checked via blood work. In fact, a lot of hospitals or laboratories will offer non-referral based blood work that you can just self-refer for. So if you look into your local lab, you can see if they have any self-referral blood work options. And I know like at our local hospital, the lab has this, and you can check mark, I want a panel run for iron, B12, and thyroid, and see what you get back, right? Because it'll give you the normal range, and then you can at least know right off the bat, okay, am I falling in normal? Am I on the low end of normal? And then work with a provider to really discuss, okay, this is what their guidelines are saying is normal versus abnormal, but what is optimal, right? Because our functional medicine values will actually look at what is optimal versus what is just, quote, normal. Hair loss is something else that we want to look at. This could indicate low thyroid function or stress response. Now, if you are postpartum within that first year, hair loss is very normal, so this is not including that. We hold on to our hair a lot more during pregnancy, so hair loss is very normal in that postpartum period. And then acne or eczema flares. So this can signal gut issues, and maybe that leaky gut syndrome, high androgen levels, so that hormone balance may be off, maybe testosterone is too high, or poor detox pathways. So we know we're going to be exposed to environmental toxins. That's a given, but we want to make sure that we're reducing our exposure and optimizing our detox abilities. So what are some root causes of those cycle imbalances? We really covered these in detail, right? So just to recap, chronic stress and hypopituitary adrenal gland axis dysfunction, nutrient deficiencies, and under eating. So that's essentially we're not getting enough input to our body versus what we're giving out. And then gut health and inflammation, endocrine disruptors, and toxin exposure. So the toxins that we take in are going to disrupt that endocrine system. So we want to avoid plastics, pesticides, synthetic fragrances, etc. And then actual true conditions that can be diagnosed, right? So PCOS, endometriosis, thyroid dysfunction, as well as other conditions. So when we kind of trial all those other things, and we're still left with this cycle irregularity, we want to dive deeper into, okay, is there an underlying diagnosis or issue going on here? And understanding that conditions such as PCOS are not necessarily one size fits all. So many women with irregular cycles don't actually have PCOS, but instead it's more of a stress-driven anovulation. And that's exactly where I fell into. My OB in high school wanted to diagnose me with PCOS, and the only factor that I had was irregular cycles. So really, my issue, as I learned, as I dove deeper into everything, as I described in episode 1, was more so a stress-driven anovulation. So we need to find out, what is this trigger for you, right? Why is your cycle not regular? And advocating for yourself if you don't feel like you fall into the box that your provider may be putting you into. I will say too, undiagnosed hypothyroidism in terms of some of those other conditions is a huge cause of cycle irregularities and infertility in today's society. So if that's something you and your provider have not looked at, make sure you do so. Now, some holistic steps to support a healthy, fertile cycle. So I want to give you some action steps before we close up this episode. Cycle syncing has a lot of talk these days, and while it's something I don't want you to like stress out about or feel like you need to hyper focus on, I do think that it can be helpful. So I linked below a blog post that dives into exercising with your cycle. So you're essentially syncing your movement, some nutrition, and self-care based off your hormonal fluctuations. And it can be really helpful, especially if you're a type A go, go, go person like myself, to have a framework to follow and recognize that there's times in your month where you're slowing down and you're specifically focusing on that. I saw huge benefits for my cycle personally, and I hope that it can be helpful for you. So again, that blog post is linked in the show notes for you and covers some cycle syncing basics. You want to nourish with real food. So let's reduce seed oils. Let's eliminate any refined sugars because we want to balance our blood sugar levels. Avoid those inflammatory foods such as those seed oils, right? And then optimize healthy fats. So that's getting in your avocado, your omega-3s from fish such as salmon. Optimizing and focusing on whole foods as much as possible and avoiding processed foods at all costs, as well as limiting your takeout so that you're not only reducing your exposure to inflammatory foods, but you're also reducing your exposure to plastics or environmental toxins, which leads to our next key step: ditch the toxins, reduce your exposure to these endocrine disruptors, swap out with healthier alternatives for your cleaning products, for your supplements, for your clothing. And I have a great free guide on this. I will actually link it in the show notes for you as well. So you're just going to have all kinds of goodness in there. But it is my go-to non-toxin resource. So I will put that in there for you. And then know when to seek support. So if you're like, I'm trying all these things, I'm cleaning up my diet, I'm syncing with my cycle in terms of exercise, I'm giving my nervous system some rest, reach out. My team and I are here to help and really dive into that more individualized approach. And whether that is working with us or whether it's seeking out additional lab work support from another provider, we can help guide you through that process. Again, whether it's working with us in-house or referring out to another provider, we take being a part of your healthcare team really seriously and knowing when to seek support and when to refer out. So again, if you're having issues in this area, you feel like you've tried all of the things, please reach out. You know where you can schedule online with us at drkaylaborchers.com. To recap, your cycle is a powerful indicator of your health. It is not just something to focus on when you're ready to conceive a baby and get pregnant. It is something to focus on well ahead of that so you can optimize your cycle health, your hormone health, your bone density, your nutrient needs, and your body's ability to manage stress across the lifespan, through those teenage years, when you're ready to conceive, and then beyond. So if you're struggling, there is hope. We can use this more holistic, integrative approach alongside the advances of modern medicine to give you solutions beyond birth control. We are going to dive deeper into all things fertility and preconception health in our next episode as well. But if this resonated with you, please share it with a friend. I hope that you found this so helpful. And then grab the free holistic health guide or the free preconception guide that is linked in the show notes. Both of those will give you so many great insights into how to support your hormone health ahead of conception. So grab the show notes, grab that, and then share this with a friend so that they can learn alongside of you.